Hello, I'm Dr. Nick, the Incrementalist, and here today to talk about blunders and wonders. This week's blunder, a failure to secure healthcare systems. Healthcare data is very lucrative for attackers, representing a rich tapestry of information that offers multiple potential value points for resale to the hacking community. That, alongside the fact that hackers know healthcare data is not typically very secure, and their affinity for out-of-date operating systems adds up to a veritable feeding frenzy of attacks on healthcare data and systems. If it's not clear, healthcare data and systems have a huge target on their back. So ignoring this from a hospital's perspective or a vendor perspective is misguided. Making sure hardware, software, and all the devices are upgraded to the latest releases is not a nice to have, but an essential part of securing safe, trustworthy service to your patients. As part of any new installation or upgrade, including a planned obsolescence of the systems you're replacing, is incredibly important. Too often, old systems and devices persist in facilities because no one was charged with the responsibility of removing them. Probably much like your own home, where you likely have a tray of old devices that you no longer use, but you haven't quite got around to getting rid of. The difference in healthcare is those devices represent potential security risks to patient safety and data security. Ultimately, your employees are your first and best line of defense, empowering them to both understand these risks and may be able to call them out and mitigate them directly. Where possible, and if not, clear lines of escalation to help desks who can action the keen insights provided by the employees at the front line of delivering care will help provide better protection to your systems and data. Your incremental step for dealing with these threats is to stop seeing cybersecurity as a cost and see it as an investment for safe, trustworthy delivery of healthcare. This week's wonder, vaccines for the immunocompromised. Let's be clear, vaccines save lives. There's no question they've contributed to some of the biggest advances in improving healthy living and almost wiping out disease. In fact, it would have been impossible for me to imagine when I was training to be a doctor over 30 years ago that I'd see a resurgence of pertussis or whooping cough and measles. But that's where we are. The underlying reasons are complex, but relate to an unfounded lack of trust in vaccines, thanks to fraudulent claims and amplification of these messages in social media. The consequence of this is a reduction in herd immunity that exposes at-risk groups who are unable to be vaccinated to diseases long thought to have been eradicated. So while we struggle to educate the population, the recently published Journal of Immunology that identified a new target protein that's important in regulating the immune response, called CBLB, in mouse models, and this is targeting with a combination of inactivated vaccine to elicit an immunity through a unique T-cell pathway. This offers us hope and an approach that may lead to protective vaccines for immuno-impaired patients, such as those undergoing chemotherapy, immunosuppressive therapy, or immune deficiency. That's great news for a wide collection of people who sadly now live in the shadow of fear of diseases that should have been left as a historical footnote, but have re-emerged as a threat. Until next time, I'm Dr. Nick, the Incrementalist. Don't let perfection stand in the way of progress.